Looks like everyone is in. Good morning, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us this morning. We have assembled our wonderful experts this morning, Dr. Ulysses Wu and Keith Grant. We thought it might be a good idea, as we are less than a week away from Thanksgiving, to sort of help you assess the risk of COVID-19 during holiday gatherings. So we again have Dr. Ulysses Wu and Keith Grant. So Keith, do you want to open it up first with some introductions, and then Ulysses, we'll give it over to you.
Sure. Hi guys, Keith Grant, Senior Assistant Director for Infection Prevention at Hartford HealthCare. It's a good space that we're in right now having this discussion. It's much better than we were in before. I'll introduce Dr. Ulysses Wu. Ulysses, if you don't mind, go ahead.
Hi, Ulysses Wu here. I'm the Assistant Director of Infectious Diseases and the Chief Epidemiologist. I think many of you know me already.
Yes, they do. So why don't we just start by talking about, we are less than a week away from Thanksgiving. Some people still getting their booster shots. What do people need to know at this point as we prepare to gather for Thanksgiving next week?
Yeah, I guess I'll start, Keith. I think it's to be cognizant and aware of your surroundings. I think that's what your statement said, I think, is the appropriate way to approach this, that this is not obviously going away anytime soon. And we have to be somewhat protective of the way that we approach this. And so when it comes to the COVID infections, it's really a delicate balance of multiple things. That is your interaction and what your immunity is with the environment that is around you. And so you control the things that you can control. And so there are simple things that you can look at, such as getting vaccinated. And if you haven't gotten vaccinated for quite some time and that your immunity could be waning, then you want to think about boosters. If you haven't gotten your booster, or if you can't get vaccinated, then you want to think about things like social distancing and masking. But the holidays, I understand that there is a desire, and this is human nature, to a return to normalcy, and we shouldn't shy away from that. I think we need to embrace normalcy at this point, but we need to be smart about it, that this could be the new normal for quite some time at this point. Now, I was actually just talking with Keith yesterday. I would love for some warmer weather, and it's actually been kind of more mild. I mean, before COVID, the reason why influenza goes up every year is because it's colder and people are not of the cold itself, but people are cohorting indoors. So that's another thing to be cognizant of being aware of your surroundings, is who are the people you're going to be hanging out with? How many people are going to be coming, and what is their vaccination status? What is their illness status? Maybe you don't want to have anybody over, or you don't want to share it at all. So these are all personal decisions, but all I'm asking is common sense, be smart about it. And things like vaccination and masking are going to be of utmost importance. Keith?
This is my new laptop. I can't hear anything they're saying. I'm supposed to be on the Zoom call.
I'm sorry, Matt. Matt, it looks like, can you just mute your line?
They can hear you.
Thank you. We can hear you. Hopefully you can hear us.
Sorry, I couldn't hear you at first. All right, sorry.
No worries. We got you.
Awesome. So not much to add to that. I think, how we've been looking at this and how we've been encouraging people and trying to educate is personal risk assessment, right? So, what's the risk that exists, not just for you, but for your family members? What is the risk that, who are the persons within the family that are most likely vectors, as in persons within certain settings that might have them on a day-to-day basis being more exposed? The individuals within your community and your family members that is most likely vaccinated. Be aware, I would say, if someone does have symptoms, they really should not be involved with any get-together this week or this coming holiday season. Ulysses touched on the boosters as well. I think, if you look at the data, the vaccines have been pivotal in getting us to a different normal or a different space from an epidemiology perspective. And I think the boosters are going to become equally more important. If you look at different stuff, one of the premier or important thing for us to consider as well. But I think having that personal accountability and devising somewhat of a risk assessment for not just for yourself, but for the rest of the family. I know vaccinations are now available for ages 5 to 11. But remember, there are still individuals who are not vaccinated and still are some that are not qualified for vaccine yet. So high risk, and there's individuals within our population that are prone to or highest risk for breakthrough infection, even if you're vaccinated. So your immunocompromised individuals and your individuals over 65. So be cognitive, be aware.
Okay, they're going to have to
Want me to come
kill
up with
it,
something
yeah.
else? Okay.
Sorry, Rob, I think you just joined. Can you just mute your line, Rob? Rob, if you can hear me, if you can mute your line, that'd be great. Thank you. Keith, thank you. Just a reminder to the media, if you have a question, just enter your question in the chat room and we will get to that. I do see a question from Tracy O'Shaughnessy from the Waterbury Republican American. She asks, if all are vaccinated at your gathering, Dr. Wu, are masks still necessary? And does it depend on the number of people present?
It's a very good question. So everybody, I'm glad that Keith talked about risk assessment, because everybody's idea of risk is going to be different. There's no absolute definition of it because risk is relative to you. So for me, yeah, if you're vaccinated, are masks necessary? It depends. It depends on what your level of risk is. For example, we're not going to be having anybody for Thanksgiving, so I'm getting rid. I'm getting rid of any risk with regards to that. From a scientific standpoint, we do know that there are breakthrough infections, and it does depend on the amount of people. It also depends on where they're coming from and what possible risky situations are they coming from. Are they coming from an area where there was a higher transmission of COVID? Are they coming from institutionalized setting, or where there's a large amount of people, such as schools or things like that, where they could be at further risk? So I think it's going to be a little bit different for everybody, but if you're having just immediate family, like a family of 4, I don't think you certainly need masks, because you're probably not having masks every single night. But if you're going to have a gathering of 30 people, it may be something that you may want to consider while people are not eating. But I should say that the vaccination doesn't completely prevent transmission, but it definitely does a better job of preventing transmission than being unvaccinated, period. Keith?
Yeah, I mean, I agree with all that. Again, personal risk assessment. You're right. If no one comes over, your risk is 0, right? If I'm definitely going to stop by your place for Thanksgiving, Yuli. So if you have immediate family, your risk is not 0, but it's exceptionally low. So if you have people within 1 or 2 people outside of your household joining in that are vaccinated, your risk is not 0, but it's exceptionally low, and so forth. So that's how I would use to mitigate it. But don't be afraid to ask the questions before individuals come, is whether or not they've, 1, been vaccinated, 2, it would be helpful if they've been previously tested and negative. And I think most importantly, if they have any form of symptoms. So don't be afraid if and I wouldn't accept it's just allergies. I would be very, I would be very cautious with statements such as that. So personal risk assessment is, to me, one of the most important things for us going through this holiday season.
We have a question from Matt Karen from Fox 61. Are masks and ventilation enough to safely invite unvaxxed family members for Thanksgiving, or do they eat at another table?
Well, I guess if you're going to have them at another table, they have to stay at that other table for the entirety of Thanksgiving. I imagine that's not going to happen. Again, it goes back to personal risk assessment, which I'm going to use from now on, Keith. And it depends on the size of the party, the size of the abode. I don't know if the weather's going to be nice. People are frying turkeys outside. Sometimes people stay outside, maybe get the fire pits going. It's probably okay outside. Indoors, it depends where they're coming from. It depends on their vaccination status. You're saying if they're unvaxxed, I would be wary, and I think mask would be the next order. If you need to look at it in order of magnitude of importance, the best protection is having nobody over. If people are going to be over, then I would say vaccinations are probably the next most important. If they're not vaccinated, then masking. And so you have to determine where in that chain where you fall, where you want to do your own personal risk assessment. Probably not enough if it's going to be held indoors. Keith?
So absolutely agree.
Sorry.
Again, if you're unvaccinated, if you're unvaccinated, your risk is obviously significantly higher for contracting the disease, and the potential for spreading the disease is higher as well. If you look at the population of positives that are in or hospital settings or hospital systems across the country, predominantly it's our unvaccinated individuals. So it remains a pandemic at this point that is highly threatening or highly targeting our unvaccinated individuals. So your risk is higher if you're unvaccinated, and that should be considered when being invited at this point in time.
And Keith and Ulysses, what if you are vaccinated, but you have not gotten your booster?
Go ahead, Keith. I'll let you go first.
Well, the data is the data. So if you look at our breakthrough cases right now, so our breakthrough cases the question that I would ask is, have we seen an increase in breakthrough cases? We have, but we haven't seen an exponential increase. So I'd say over the last 4 or 5 months, we've seen anywhere from about a 5 to 10% increase in our breakthrough cases. So can we appreciate that as an increase in or a decrease in the efficacy of the vaccine for individuals who've gotten vaccine a few months ago? I can tell you there's a conversation being had with the population that we're seeing the breakthrough cases in, or individuals over 65. And if you look at when vaccines were approved, the first set of individuals to get their vaccines were individuals over 65. So are we seeing this as a result of, or are we just seeing it as a result of immunity and the natural aging process as well? We're not 100% sure. I will say boosters at this point, if you want to maintain, if you took the vaccine as an appreciation of what the efficacy in the trials show, and it's protected you since then, the boosters are the closest thing to get back to that belief. At this point, the boosters will get you back to, or even more than, the original efficacy that was identified in the trials, which is over 90%. So.
Yeah, I think we need to take a 1,000-foot step back and look at the whole big picture. Vaccination and boosters, the only reason why we almost have a relatively normal sense of normalcy at this point is because of vaccination and boosters. And then if you look at the flip side, it's not a silver bullet. Keith has touched on it. We have definitely had some breakthroughs. And as that immunity wanes, I think we're going to have more breakthroughs. I think we were originally around 20%. We're probably about 30% of hospitalizations at this point. But the higher level of care that is required, ICU ventilations, and unfortunately death, the more likely you are to be unvaccinated. So vaccinations work. I think the boosters, it makes sense. And I do agree with expanding to everybody, because right now it's a little confusing to people. It's like, well, do I qualify? Do I not qualify? Do I need to calculate my BMI? Things like that. And now it just takes away the confusion, because we know that people without those risk factors can still get it, and they can still pass it on to other people. So I agree with it from the standpoint that it takes away from the confusion. And I do believe that it is safe.
All right, thank you both for answering my question. Another question from Tracy from the Waterbury Republican American. Do you agree with Governor Lamont on boosters? Others say they want to wait for the FDA.
So
go ahead, Keith. That's all you.
Yeah, so I never want to say I disagree with Governor Lamont, but I think if you listen to his statement, he was clear that he said that, in my opinion, this is, individuals that haven't been vaccinated since January, or have been vaccinated in January and so forth, should all qualify for the booster, should all get the booster. I think from a science perspective, what we're seeing now, it's hard to disagree with that actual statement. Has the FDA actually come out and approved that at this point? They haven't. I know there's conversation, and we expect to possibly see something as early as could be today, that we're going to see something. I think there's an article that was just put up by Alex. I think there's a lot of conversations about it right now. I do expect this to be approved. And I agree with Ulysses in that it removes a lot of the complexity and the complication. And logistically, for individuals, for organizations who are supporting boosters, it removes that framework of complexity in building the logistical platform to deliver boosters, right? So I don't want to say I don't disagree with Governor Lamont, but at the same time, there's a process that established by the CDC, through the FDA, that we will be able to appreciate in the coming days, that I most likely will approve exactly what he said.
All right, we have a question from Nicole Leonard from WNPR. Can someone address the FDA's official decision this morning to expand Pfizer and Moderna boosters to all adults 18 and over in the US, and now that they may impact holiday and how they may impact holiday gatherings of family members coming from different states?
Yeah, I think it's similar to what Keith has just answered. I think from a temporal standpoint, boosters now are not going to impact Thanksgiving at all because, well, this decision, because it does take time for your immune system to ramp up. So with regards to people traveling for Thanksgiving, it's going to have no impact. But for the future holidays after that, it's definitely going to have some impact as well. And so I don't think I need to expound more on that more than what Keith has said, eloquently said.
All right, question from Matt Karen from Fox 61. Do you see this causing division within families? What would you suggest to family members who think it's too intrusive to ask another person if they are vaccinated?
Well, this is, if you all have 2 hours, we can talk about the sociologic experiment that has happened in this country. I mean, the reality is that this is a scientific discussion, and when we expand into the sociologic implications of this, it gets difficult because it's muddy. So, for example, getting the vaccine is by far, I totally agree, a personal choice. But people forget the ... And the ... is personal choice with societal implications. And that's where where it gets muddy. And so I don't think we're going to be able to answer in terms of this causing division amongst families, because it is going to cause division among some families and other families who it's not really going to be a big deal. And it's going to be like, let's have those courageous conversations. And so personally, to me, I don't think it's intrusive because of the societal implications of somebody coming to your abode or you going to somebody else's abode where somebody may be sick. I think it's okay to have these courageous conversations and not try to hide behind ideologic lines to sow division at this point. But I wax poetic on that. Keith?
I'm going to plead the fifth on it. It's very difficult, but
Yeah.
I'll plead the fifth on it.
And I will go to the next question. And that comes from Hugh McQuaid from CT News Junkie. Dr. Wu touched on this, but do you expect these types of precautions will be necessary for the foreseeable future?
Yes, it's not going away. Until we can get to a decent vaccination rate and we can get transmission down where we can turn this into a seasonal disease that's not a pandemic. Yeah, nothing has really changed from a precaution standpoint from last year, except now we have vaccinations. So, yeah. And we have some natural immunity.
And to be honest with you, not much has changed from the conversation that I introduced about personal risk assessment, right? Before the pandemic, if someone wasn't feeling well, you really should have that discussion with them or whether or not they should be around everyone, right? So, do we expect within 2 or 3 years to be having the same exact conversation about this in considering the amount of COVID-19 that's circulating? I expect it to be significantly less. I do expect us to be in a different position. And we said the same thing last year. But at the same time, I agree with Ulysses in that, the things that we depend on to really make the significant shift in this pandemic is, more individuals getting vaccinated and more individuals being cautious about the risk management and risk mitigation strategies as they go about their day-to-day activities.
I do want to touch on that personal risk assessment that, again, I know that I keep bringing it back up because I love what Keith has said about it. To answer the question, what we need to look that's different is the personal risk assessment has changed. The thresholds has changed. Keith and I have noticed that behaviors are much, much, much more different than from 2 years ago. Remember, March 2020, healthcare workers were going home and getting naked on their front porch because they didn't want to bring anything in to their home. Nobody was going outside. Driving to work was actually quite magnificent because nobody was on the road. And now these precautions, we see they're being relaxed by individuals and their own personal risk assessment. What do I mean by that? They are taking more and more risks because either they got vaccinated or because they had immunity, or they're just fatigued from COVID and they don't really care as much anymore, amongst many other reasons. So that is the one thing that has changed, is that personal risk assessment.
We have a follow-up question or two from Tracy at the Waterbury Republican American. Pfizer and Merck have both developed oral antiviral medications. Both companies have requested FDA emergency approval. From what you have read, how do you think these drugs, if approved, will affect the course of the pandemic, and how do they compare to what you have for therapeutics now?
You want me to go?
I'll start really quickly. I don't think it
go.
will affect the course of the pandemic. It will not affect the actual course of the pandemic. Keep in mind, this is a treatment modality that is achieved or that is introduced at hopefully when someone already got the disease, is in the hospital, and is at a point that we need to administer antivirals, right? The course of the pandemic is going to be impacted by infection prevention measures, such as that which has been implemented so far, to include your vaccination itself. I think from a therapeutic perspective, this, if it works, such as been demonstrated within this trial, this is a wonderful tool to have. It's a very, very good tool. It's shown exceptional efficacy and with a very good degree of safety as well. But I don't think this is going to change the actual course of the pandemic itself.
Yeah, Keith is absolutely right. This is all after the fact. And it's going to be a game changer from a treatment modality standpoint. It may keep people out of the hospital. I think that's going to be very important, but it doesn't change the course. And I saw that Alex was on the phone, and I know he loves my analogies. I'm trying to think of a good analogy. It's like if you're in a car accident, you know, your seatbelt is your vaccine. Like we want to, well, no, that's probably not right. Safe driving would be your vaccine. You don't want to get into that car accident in that first place. Whereas these medicines, which are going to be great, is kind of like either your seatbelt or your car insurance. It's going to protect you to a certain extent, but it doesn't stop the fact that you got into the car accident in the first place. And so the only way to really nip this pandemic in the bud is it's still vaccinations, and masking and social distancing are still the only way out, but it will keep people out of the hospital. And that's what's important. Though I'm going to say it may be a curse at the same time, because what I'm worried about is with these medications that vaccination rates will go down because people will say, oh, we got these meds. If I get it, I'll just take one of these meds. It'll be perfectly fine. We still need to get vaccinations in the people's arms.
Follow-up question from Tracy. If we have wide ability of boosters, does that change the meaning of fully vaccinated?
No. If you're fully vaccinated, you're fully vaccinated. I mean, it depends on how your body received the vaccine. So we know that there are certain patient populations that may not have been able to mount the immune response. But in terms of the clinical definition of getting your 2 shots in a booster, I think that I'm not sure I answering the question or maybe understanding it, but yeah. I'm going to say it doesn't change.
It doesn't change. It doesn't. So there's 2 categories that we look at. So individuals who are unable to mount a full vaccine, a full response, and most likely are individuals who are immunocompromised. Hence the reason a 3rd dose was introduced. And at that point, you'd consider that person to be fully vaccinated. So an individual now who has been able to mount a full immune response and is qualified for a booster is someone that's been fully vaccinated and now is getting a booster. So the definition of fully vaccinated wouldn't change or hasn't changed.
Okay, Tracy's also asking, what is that decent vaccination rate that we need to get to?
And I'm reading ahead also to follow. Tracy also typed in, I think she's correcting her questions. She said, forgive me,
yes.
Is 2 shots and a booster considered fully vaccinated, or are 2 shots fully vaccinated? So it depends by whose definition you're going by. From a healthcare perspective, 2 shots alone is not fully vaccinated if it's greater than 6 months. But there are some businesses, planes, air travel, all that, where 2 shots is enough to be considered fully vaccinated. But from an immune standpoint, it is not. And to answer the question, what is the decent vaccination rate? It depends who you talk to. I've been saying from the get-go that it's 90%. We need to get to that point. I know Dr. Fauci, there's been some criticism of him because originally he said 60%, then it was 70%, now it's 80%. But his moving target, there are reasons why he has given a moving target for that. But from an absolute standpoint, a decent vaccination rate, 90% for me.
Keith, anything to add?
I don't challenge Ulysses with numbers, so.
You can challenge me. He's going to say 91%. It's like The Price is Right.
And
Yeah,
$1.
I do think I'm supportive of 85%. From a realistic standpoint, I do think the higher you get, the better off you are. And the other piece of it for us, there's no way for us to measure. I mean, we've just experienced a significant exposure with or significant presence of the Delta variant with a really high R0 or reproductive factor and highly contagious. So there's no way for us to really appreciate that at this point of individuals who's been exposed, have some form of immunity based on that exposure, and couple that with the individuals that's been vaccinated across the state. So we could be closer to that than we think, but a pure number, mathematically, I think it would be closer to 90% or even higher. I agree with Ulysses.
Yeah, and 85 would be great. You know, just to let you know where the 90 is coming from, when we've looked at previous vaccinations, all the vaccinations we've given in our history, 90% is kind of the threshold that we sort of look at. But 85% would be awesome.
Yep.
From numbers to letters, it looks like Alex Putterman at the Hartford Current gave you a B+, Dr. Wu, for that analogy. So we'll strive for that A+ next time.
I'm not taking his calls anymore.
All right, you heard it here. Now, Tracy has another follow-up question. Given the upcoming gatherings, could you go over mask wearing? Which are best? How are they to be worn? A bit of a refresher course, if you would, doctors, please.
That's all, Keith.
So, not all masks are created equal. So that's the first thing. And the other part of it, not all facial structure is created equal. So those are the two things. I think the key piece of it is whatever mask you're wearing needs to be closely fitted. That's the absolute key piece of it. I see a lot of people wearing an N95 that's not really close fitted. And I also see a lot of people that are wearing a mask that is below the nose itself. I think one of the first thing you need to do, and I'll put my mask on, one of the first thing you need to do is ensure that there's an actual fit that is achieved above the nose bridge itself before you appreciate the mask to be fully fitted. This definitely, if the mask keep moving down, it could be that the mask itself is too big for you. If there's a lot of space or gap in between the cheek area and where the mask should make contact to your face itself, could also mean that the mask is way too big for you. The other thing that a lot of people have made complaining comments about is after wearing a mask for a period of time, there's some pain or discomfort around the ear. That's something you want to address, and normally it means that the straps are too tight for that mask, and it could also mean that the mask itself is too small. So I would say close-fitting masks, fitment should start above here. It helps a lot, and it prevents it from falling up below your nose, and ensuring that the size is right as well. The other thing I would say is you try to use a buddy system. So if Ulysses will come to my office and he has a tendency to wear his mask for a very long time. So he'll come to my office and I will say, you need to change that mask as soon as possible. So if you see someone that seems like they need some help or information about masking, please let us know. And if you see someone within the community that is struggling to find a mask or mask that's helpful, please feel free to reach out to ourselves. We have no problem with providing that.
And Keith, we see a lot of people that will wear their mask. I saw the way that you put it on, but we see them crisscrossing and then going behind their ears. Is that not recommended?
So the thing with crisscrossing, it's recommended. I shouldn't say it's recommended, but it's very helpful for the wearer. So what it does is it creates more tension on the upper bridge and lower bridge, right? So when you put it on your crisscross, it actually drags it and creates tension. But if you realize what happens, it creates an opening space here. So it helps you from a protection perspective, but it doesn't help the people around you as much because you now create openings that will, the N95s that has the vents on the front, I've spoken to people about it as well. It helps you a lot, but it doesn't help everyone else around you. And that's basically what you're doing when you do that. It creates that space most often, and it allows you to vent out. And it helps you a lot, but it might not help everyone else around you.
Yeah, and that's where the double masking came from, by the way. Everybody thought it was 2 layers of protection, and the virus is not going to get through that. It actually had everything to do with fit. That's what that second mask does, is it provides a better fit.
Tracy has a follow-up question. Does material matter?
Absolutely.
Yep.
It definitely matters. So we actually I wish I was in my office so I could demonstrate this to you
I
guys.
can go get it. You want me to get
absolutely.
it?
Definitely. It's on my desk if you don't mind grabbing it. So there's a mask that we got to review. And I had asked Ulysses to look at it. And it was like, you know, we get masks all the time, we review it. And most of these masks are already approved for health systems. And what we do is we'll check, you know, resilience. We will check for penetration. We'll check for wearability. Some of the masks I'll wear for a long period of time just to see how it works. And we'll check a bunch of stuff. So the first thing that we did with this mask, we picked it up and you just put a little bit of pressure and it just ripped apart. And I was like, you know, probably this one is defective. And we went through like 10 in the box and we kept doing that and kept doing that. And I reached out to the company and they're like, well, it's very breathable. But I was like, but it doesn't make sense. Like you wear it for 2 minutes and then the mask just breaks apart. Did you get it, Yuli?
I think you threw them out.
Oh, I might have turned them out. But yeah, so material is very, very important. It needs to be breathable, but at the same time with good filtration. Breathability is important. Filtration is important. The reason why breathability is important for me is if it's not comfortable, you're going to have the need to constantly take it down. That's key. The other part of it is there's a lot of conversation very early on what these masks actually do for your respiratory system. Does it restrict breathing? You actually have a physical process of preventing that full intake of air. So it does have an impact. So it needs to be breathable for you to be comfortable. And it also needs to be, you shouldn't do a full restriction of the very important oxygen that you need coming in. I wish we had those masks so you could see it, but.
Next time, we'll work on that. I don't see any additional questions in the chat. Why don't we do final thoughts? Ulysses, do you want to start?
Yeah, I think the boosters, it's a game changer from the standpoint that it's going to make everything less complex. We do know that immunity has waned either from natural infection or from the vaccination itself. And I do want to touch on the fact that, yes, if you have got natural infection, you still should get the vaccine at this point. A lot of the questions revolve around, you know, how long are we going to do this and what is the new norm? Unfortunately, this is the new norm until we can get to a decent vaccination rate where we can make this disease not as prevalent. I think the key of risk assessment that's the key word at this point. And everybody has an individual risk assessment, and we need to understand that everybody has an individual risk assessment. And it does involve an element of personal choice with societal consequences. And so going forward, I think common sense is probably the best thing that we need to do. And we need to get ready because the weather is getting colder. We have holidays coming up. People are going to be cohorted indoors. We hope that numbers don't rise too much, if at all. But common sense is a necessity at this point. Keith? Yeah,
absolutely. So I think personal risk assessment, I've said it many times and I'll continue to say it. And I do think, you know, one of the unsung heroes of all of this is how we've been able to collaboratively get message out to our communities. So not just through, you know, Tina and her team does a wonderful job, but, you know, there's many people on this call that we've now have almost personal relationships with in, you know, getting information out. So we need to continue to do that and stress the fact that this pandemic is not over. There's still people, unfortunately, dying from this disease process. There's a lot of control that we have as a community if we continue to live in that space with that acknowledgement that this is still a serious disease process, and the mitigation strategies that we've put in place to include vaccination and now the approval of boosters for all put us in a very better position to have a brighter future. So hopefully next year, this time we're having a different kind of discussion about appreciating the holiday. But at this point, personal risk assessment, be safe, enjoy the holiday, and hopefully we'll communicate again very soon.
And I do have one more thing to add, because I know I'm going to get a lot of questions about the epidemiology, because we're always asked about the fortune telling. So as you all know, the epidemiology, we did creep up. And the time was actually right. I don't know the exact reasons why, but it was right around the time of that post-Halloween. And then November 2nd, I think we had our first frost. So it was right around that time that we started having, I'm not going to say a spike, just numbers started increasing, and they started they're starting to decrease at this point. Looking in our crystal ball, if I had to put my Karnak hat on, looking forward, our next big hurdle is going to be Thanksgiving. I looked at the 14-day AccuWeather going forward, and it seems to be actually pretty relatively mild. So we need sustained deep freezes that are going to force everybody indoors. But our next hurdle would be probably Thanksgiving. So if we're going to see an increase in numbers because of the holiday, not the weather, but the holiday alone, we would look towards positive cases increasing the first week of December, hospitalizations increasing in the second week. But we'll see. And hopefully it doesn't happen.
I have a question just before we wrap up regarding flu. Are you at all concerned with, some people don't get flu shots. A lot of people are vaccinated with COVID. We hear all about it, but flu is sort of taken a backseat. I think you don't hear so much about flu. What are your thoughts on flu coming into the season and coming into the holiday season?
I'll just say real quick, we need to treat it the same as COVID at this point. Please get your flu shot. The big difference from last year is the lack of mask mandates at this point. We've already started seeing probably more flu than we saw last year. It's very sporadic, but it's certainly prevalent. Those of you who may have kids or grandkids, you probably have seen a lot of sniffy noses and runny noses as well. So all those other respiratory diseases are coming back, such as para-influenza has made an appearance. RSV, you probably heard about. We're certainly seeing plenty of that. Rhinovirus is very prevalent. And the OG, which I'm going to say the OG coronavirus, they've actually made a comeback as well. So these are the pre-COVID coronaviruses that cause common colds. And so everything that we just said about COVID holds the same for all those other respiratory diseases. Keith?
I have not much to add. I think we've definitely changed the epidemiology of most other respiratory diseases because of our mandates that were in place. That definitely protects us generally, not just from COVID-19. But that being said, they still are here, they still exist, and we need to prepare ourselves as much to fight them when they do exist.
Great. Thank you both for answering that question. I just wanted to make sure that we get that out there because I'm not hearing much about flu. So, and that's just as critically important, especially as we go into the holiday season. So thank you both for answering the questions and all of the questions from the media. It's always so helpful. We appreciate it. And for all of the media on the line, thank you for joining, and we hope you all have a safe and wonderful, happy Thanksgiving. Thanks, everyone.
B+, Alex, B+. I'll remember that.
You'll do better next time. I know it, Doctor.
Well, I could use the pool analogy, but I can't use that one.
Good job, team.
Bye-bye.